to show for it. And those of us with a local government background will know that the social care sector has been crying out for a sustainable financial settlement for at least 2 decades. The fair access criteria, which were implemented by a Labour government in 2003, precipitated a financial crisis in a sector which was already under pressure by removing local authority discretion about services and failing to provide the funding for the new model. And existing charging policies and council tax precepts have proved unable to bridge that gap. As a chairman of a social services committee in those days, I looked my residents in the eye whilst imposing Labour's charging policy for social care upon them. So I welcome the government's courage in bringing forward a proposal tonight which looks both realistic and workable.
Will he give way on that point?
I'll be pleased to give way to one.
I'm interested, from his local government background, whether he thinks that this policy will fit within a wider local government finance reform agenda.
The Honourable Member for Milton Keynes is absolutely correct to highlight that wider reform agenda. I know we are anticipating more detailed proposals from government in due course. But it's clear, and he will know this from his local government experience, that if we are serious in this House about fixing social care, much of which is not about the elderly, but working with adults and children with disabilities, we must learn the lessons from the sector of several decades of change. And firstly, Madam Deputy Speaker, we must reflect on the lessons of the Better Care Fund, which taught us that councils have been the efficient delivery partner. And even when the sole focus has been to relieve pressure on the NHS, councils have been much more efficient on the whole in using those funds. So we must avoid, as many members have said, that convenient political mistake of allowing it all to disappear into an NHS black hole with nothing to show for it. But having learnt the lessons of the Better Care Fund, we have to ensure that those additional national insurance costs don't consume the extra funding. And I know I've heard ministers' assurances about this, but the care sector has heard many times of new funding which has been cancelled out by deductions from other budgets. So we need absolute clarity that this will find its way to the front line. The second issue which I'd like to highlight, Madam Deputy Speaker, is the point that this affects not just the elderly. Around 2/3 of social care costs are for working age adults and children. And in many of those cases, the NHS is barely involved. But the costs can be eye-wateringly high. So we need to make sure that as we direct those funds, as the member for Milton Keynes highlighted, that they are getting to where they are required. The third lesson, and this has been mentioned by a couple of members, is how the market responds. We have a thriving market for social care in this country, including charities, including the private sector and local authorities. And we know many of those organisations will see the £86,000 as a very tempting target. The sooner you spend your £86,000, the sooner the state steps in. So we need to ensure that we've learnt the lessons of what's happened with the involvement of some businesses, particularly in the children's social care sector, and make sure that this is not seen as simply an opportunity to rip off the taxpayer. So finally, Madam Deputy Speaker, may I urge ministers to review the operation of the fair access criteria and the rules that underpin them. The rule of provide for one and provide for all that was clarified by a subsequent judicial review of the London Borough of Harrow forced the retrenchment of local authorities in adult social care towards only serving the most critical needs of people in our constituencies. And many of those... I'll be pleased to give way to it.
The Honourable Gentleman, I'm very grateful to the Honourable Gentleman for giving way, and he's giving an excellent speech. I think one of the things that he's touched on, perhaps not expanded on, is the efficiencies that local government has found. And are there any particular lessons that he thinks are relevant to the NHS as we move forward?
For time, this is not fair on the ministers who are winding up. David Simmons.
Madam Deputy Speaker, so concluding rapidly, it is a very important point that is made. What we need to recognise, many constituents are surprised to discover that as a matter of law, very strict eligibility criteria restrict what they can access. So we need to ensure, as we reform the sector, that we free up local authorities to use these resources to meet those demographic challenges.
Yeah.
Shadow Chief Secretary to the Treasury, Bridget Phillipson.
Thank you, Madam Deputy Speaker. It's customary when closing a debate to say we've had a good debate, and indeed we have. But I think what's been most striking is how inadequate a basis it has been for a change of this magnitude to the tax system of our country. And I'll intend to come back to that point. We heard a number of extremely sharp and insightful contributions, including my honourable friends from Wallasey and from Nottingham East, who talked very powerfully about how what has been set out does nothing to improve the working conditions facing social care workers, many of whom will now themselves be facing a tax rise. And I'd just like to say it's wonderful to see my honourable friend back in her place in this House. We also heard contributions from the Chair of the Public Accounts Committee and the Chair of the Communities and Local Government Select Committees, who asked very important questions of ministers. And we didn't get answers to those questions, and I hope the Chief Secretary could address those really important points that were raised, and I'll touch on those a little later on. We also heard from the members from Birmingham Selly-Oak, from Eltham, Bedford, Brighton Kemp Town, Bristol South, Lewisham East and Hornsey and Wood Green. They all covered a range of different points, but they were all clear that this does not represent a proper plan for the NHS or for social care. It is instead a broken promise. 2.5 million working households hit by the Tory double whammy of cuts to universal credit and an increase in national insurance. Now, understandably, I focused on contributions from Labour members. And I'm sad that, except for a few honourable members opposite, I mean, notably the member from Rossendale and Darwin, many of those who were very bravely stating their reservations over the weekend to the Sunday newspapers have been strangely silent this evening. And I was hoping we might have heard from whichever Tory MP said that putting up national insurance would be morally and economically wrong. It kicks in at a low level. If you get all your income from investments in property, you don't pay a penny. But if you work your guts out for the minimum wage, you get clobbered. Madam Deputy Speaker, I could not agree more. I'll happily give way.
I'm very grateful for giving way. That point's been made on a number of occasions today about rental income. If you hold your properties in a limited company, and you will take your profits through dividends, those dividends are taxed to include the social care levy. Will she there put the record straight and accept that that is the case?
Madam Deputy Speaker, it is absolutely ludicrous that if you are a landlord, you will be paying not a single penny more, but your tenants, however, many of them perhaps working in the NHS or social care themselves, are about to be clobbered by a tax rise. 95% of what is to be raised from this will come from working people and businesses. It is just not simply right what he is saying. I understand this afternoon, Madam Deputy Speaker, that one former Cabinet Minister used perhaps more colourful language this afternoon. And I won't test your patience by repeating exactly what they said, but safe to say he or she is not a fan of this Tory tax hike. Now, it's usual for major fiscal events in this House to be timetabled in advance. Indeed, this week the Chancellor put us all on notice of a comprehensive spending review and an autumn budget just at the end of next month. It's also usual for major fiscal events to be accompanied by independent and thorough scrutiny by the Office for Budget Responsibility. And it's also usual for those forecasts to be published alongside the government's plans so that all members of this House can understand in detail what they are voting for, how it will affect the public finances, how it will affect the livelihoods of our constituents, and how it will affect the success of the economy. Now, the OBR's typically thorough work back in March produced a report with over 130 charts and tables, and the flimsy document produced by the government yesterday had just 3. Now, I recall when some members opposite were sticklers for the rights of this House, sticklers for procedure, for proper time to debate and consider changes which will have a huge impact on our society and on the shape of our economy. Now, it seems those days are long gone. The change that we're being asked to vote through tonight is not being introduced in this extraordinary form because it's right for the country. The House knows that. It is because it is the right approach for the Prime Minister. Announcement on Tuesday, vote on Wednesday, maybe reshuffle later this week, backbench rebellion averted. It is no way to run a country. And let us be clear about what is happening. This House is being asked to approve, at almost no notice, an extra £11.4 billion of taxation on workers and businesses, and an extra £600 million on dividend taxes. 95% of the new revenue is to come from taxing jobs and earnings. When this government needs income, it doesn't turn first to those with assets, stocks and shares, property, to those with the broadest shoulders who can afford a little more. No, it turns to working people, to those who work hard to earn their income and to their employers. And it breaks a solemn promise that every member opposite made to the people of this country. It is a choice, and it is not a choice that this party would make. There are two other major questions which emerge from the contributions today. Where is the government's actual plan? We need a real plan for social care, not just a few numbered paragraphs and a handful of case studies. Labour's priority will be to give older and disabled people the chance to live the life that they choose, shifting the focus of support towards prevention and early help. And let us not forget in this place that around half of the social care budget supports working age adults with disabilities, far too often overlooked in these discussions on social care, and the government's announcement does nothing for them. Alongside a strong and skilled social care workforce, Labour would deliver a new deal for care workers to create a well-motivated and properly rewarded workforce with clear support for unpaid carers, those very people that got us through the last 18 months, that we clapped, that we claim to care about. There's absolutely no sign of that plan here today or in the documents published yesterday, because the document the government published yesterday is strikingly poor on the practicalities of delivery, not just for social care, but for our NHS as well. Our National Health Service was chronically overstretched long before the pandemic ever hit. We entered the pandemic with over 100,000 vacancies, and by March of this year, there were 5 million people on waiting lists for NHS treatment, waiting longer for cancer care, longer for vital surgery, longer for mental health support. What we have been given today is not a plan. It is the promise, another promise, of a plan to follow. The Minister couldn't even tell us what the impact would be on waiting times. He couldn't tell us what it meant for local authorities on the front line. He couldn't give us details of how public sector bodies are expected to meet the cost. It isn't a plan, it is just a tax rise. And much of this debate today has focused on whether it's the right sort of tax rise. Now, I'd say sometimes it's easy to focus on the fiscal aspects and forget the economic aspects too. Our recovery is still fragile. Businesses are under enormous pressure. We all know it. Many are yet to fully reopen, many not yet operating at full capacity. And yet the Chancellor has been putting up council tax. He's slashing universal credit, he's freezing income tax thresholds, he's sucking demand out of our economy at the worst possible time. Now, my honourable friend, the Shadow Chancellor, set out powerfully what this means for working people. But this isn't just a series of hammer blows for working people. It is for firms too. Small businesses struggling to get back on track after a terrible 18 months. They have been clear that, in the words of the Federation of Small Businesses, this is precisely the wrong moment to be putting up the cost of taking on and retaining staff. And they estimate this afternoon these changes could mean an extra 50,000 people out of work. This is the wrong process to agree the wrong tax at the wrong time. It won't deliver what is promised for our health and social care sectors. The Health Secretary can't even tell us if it will clear the NHS backlog this Parliament. It won't give social care the resources it needs in the next 3 years. There isn't a plan for reform of social care. It will not create more and better paid jobs in the wider economy. It is not fair across the regions. It will not end people having to sell their homes to fund their care, and it will not help our economic recovery. The Prime Minister cannot even guarantee that it is the last unfair tax rise of this Parliament. Tonight, we are not voting for a plan to fix social care. There isn't one. We are voting on the third Tory tax rise on working people, and we will oppose it.
Chief Secretary to the Treasury, Steve Barclay.
Thank you, Madam Deputy Speaker. Let me first thank members and right honourable members for their thoughtful and constructive contributions during today's debate. Yesterday, the Prime Minister set out a series of necessary steps to tackle the COVID backlogs, reform adult social care, and bring the health and social care system closer together on a long-term sustainable footing. As the House well knows, the pandemic has put unprecedented pressure on the NHS. The number of patients waiting for elective surgery and routine treatment in England is now at a record high of 5.5 million. If left unchecked, this could reach 13 million, an issue of concern across the House. At the same time, this country is facing a long-standing challenge to the social care system. Typically, around 1 in 7 must pay over £100,000 for care, with bills falling indiscriminately on some of the sickest and most vulnerable in society. The government's response, the plan we have debated today, means an investment of £36 billion in the health and care system over the next 3 years. Patients across the country will benefit from the biggest catch-up programme in the NHS's history. And the social care system will finally be reformed, ending unpredictable and catastrophic care costs faced by thousands and making the system fairer for all. And I just gently say to the Shadow Chief Secretary, who just said a moment ago in her closing remarks that this is not the right time, I think many times in this House people have highlighted the urgency of acting, both on the COVID backlog and on social care. Now, as one of the prominent critics of the government's process, of course I'll give way to my honourable friend.
I thank my right honourable friend. He's very helpfully said that 1 in 7, I believe he said, of people currently in the care system pay over £100,000. Could he just say in absolute numbers how many that is in any given year or any period he chooses? And if he doesn't have the information with him tonight, or can't get it from the box, could he write to me with that information and put a copy in the House of Commons library before we have our next debate?
I'm glad Madam Deputy highlights that, and let me address that in 2 ways, because it goes to the crux of his remarks during the debate. Firstly, we have set out, as was referred to even again by critics of the government, the illustrative analysis in terms of the impact of this from a distributional point of view, with the lower income households being the largest net beneficiaries. And we've also said that we will say more on that because it will evolve, obviously, by 23, when those on state age who are working come within scope. Obviously, the distributional analysis will change. But let me take head on his central concern, which was his constituents in Rosendale and Darwin, because of the lower housing costs, will be disproportionately impacted. But firstly, if one looks at London, the Evening Standard, for example, is concerned that 14% of those will pay the lion's share of the cost, because that's where the highest concentration of higher taxpayers are. But also for his constituents, I think one of the key aspects of the reform is it ends the unpredictability of costs through the cap. And it also, again, if I look at, for example, the northeast of England, where the Resolution Foundation found that only 29% of individuals aged over 70 in the northeast have sufficient eligible assets, that they won't receive any state support. So the point is, the uplifting in the means test that my right honourable friend the Chancellor set out, again, benefits those parts of the country to which he was championing. I've just given way and address his points head on. Let me, in turn, address the points of the Shadow Chancellor head on. And the Shadow Chancellor's speech said that she opposed this levy, despite, as a number of members pointed out, the previous Labour government taking a similar approach in 2002-3, because she said that she supports taxing wealth. But the problem with that, Madam Deputy Speaker, is only a broad-based tax base, like income tax, VAT or national insurance contributions, can raise the sums needed for such a significant investment. Again, a point, in fact, made by critics of the government, including my good friend, the member for Wickham. So it could not be raised by taxes on wealth, because currently 6 billion is raised from inheritance tax, 8.7 billion from capital gains tax, and 12.3 billion from the property transaction. And indeed, that case was demolished by the chair of the Treasury Select Committee, my right honourable friend, but also by the member for Dudley and indeed the member for Thirsk and Moulton, who highlighted that to raise the revenue requires a broad-based approach. Of course, I give way.
Grateful to the Minister for giving way. On the subject of cases being demolished, one of the cases that his colleagues have made a great deal of play on today, the case of the fictional Yusuf in the government's own document. According to the government, Yusuf's care home costs us £700 a week, and they claim under the current system they'd have had to spend £293,000 before it reached the current cap. The Minister will be aware, I hope we can count, that in order to spend £293,000, £100,000 at £700 a week.
Gentleman to put his question.
What percentage of people going into a care home have got any chance of being still alive in 9 years' time?
Well, of course, one of the features of Dilnot, and Dilnot has been very frank about this, is his costs ramp up over time, and so that's why the initial funding is 5.4 billion, but obviously the social care element will increase. But I will come to the case put forward by the SNP, who seem to not want the union dividend that is actually offered, bizarrely, and seem to not be seeking this additional funding. But let me finish on the amendment that's been put forward by the... I will come to the devolution points and happily give way at that stage. But let me just deal with the opposition amendment, which requests a distributional impact assessment. And indeed, as we have covered, that has been set out today. The government has already published an impact of our health and social care on households, looking at the impacts of both the new spending and the levy, with a full distribution analysis being published at the budget and spending review. But looking at the impact on businesses will play their part in the funding of this plan. However, existing national insurance contribution release and allowances will also apply to the levy. So this means that 40% of all businesses will be not affected due to the employment allowance, and it allows eligible employees to reduce their national insurance liability by up to £4,000. And again, that was a point brought out by my right honourable friend, the member for South West Wiltshire, who highlighted the impact on business and the fact that actually it is the businesses with 1% of the highest turnover that will cover 70% of the cost of business. Of course, I give way.
Giving way. I think he probably knows the point I'm going to raise. I'm very interested in the impact on local authorities. Will it just say, out of the £36 billion to be raised over 3 years, how much extra money will go to local authorities after the costs of the cap and floor system have been taken into account? How much extra money over 3 years to local authorities out of the £36 billion?
I listen very closely to his speech because he is a very informed and knowledgeable commentator on these issues, and quite rightly he pointed to paragraph 36, where we've been quite clear in terms of the role in terms of demographic and unit pressure. But as he well knows, part of the discussion at a spending review is to look at local government pressures in the round, and that is in the context also local authorities that are getting an additional £2.2 billion of additional funding. And I just simply remind the House that in terms of the adult social care flexibility that was allowed for councils this year, out of 152 local authorities, less than 2/3 actually used that flexibility. So that is part of looking at these issues in context in the round. Just make some progress and come to the central point put forward by the SNP, which was very demolished by my honourable friend, the member for Warwickshire, Roxburgh and Selkirk. Because all parts of the United Kingdom need a long-term solution to fund health and social care. Yeah. The Scottish Government's own independent review of adult social care recently noted, I'm quoting from your own review, I thought you'd want to hear that. It says that Scotland's ageing demography means that more money will be needed to be spent on adult social care over the long term, and that its recommendations to the Scottish Government would require a long-term and substantial uplift in adult social care funding. And in fact, in 2003, John Swinney said that a 1% increase was, quotes, progressive taxation, and it was, quotes, required to invest in a health service in Scotland. Now, of course I give way.
Except that that was 18 years ago and things have changed, and since that time national insurance has not been reformed in any way to protect the poorest as income tax has been.
Well, obviously what they regard as progressive has changed, but the point is if they disagree with this, they can adjust their bonnet consequentials and spend that and reprioritise their spending accordingly. And indeed, likewise, the member for Carmarthen East, who I hold in great affection, and he speaks very powerfully in the chamber, but he said, and I quote, "These are English priorities. Clearing the COVID backlog, addressing the challenge of social care are not English priorities, they're United Kingdom priorities. They're this government's priorities, and they're the people's priorities." Given time, Madam Deputy Speaker, this levy will enable the biggest catch-up initiative in the history of the NHS, a comprehensive long-term solution to the social care challenge, a significant long-term investment which will directly improve people's lives. And I say to the member for Wellingborough, I think those issues he values, and I hope he will support them. The Prime Minister said yesterday you can't fix the COVID backlogs without giving the NHS the money it needs. You can't fix the NHS without fixing social care, and you can't fix social care without removing the fear of losing everything to pay for it. Madam Deputy Speaker, this plan addresses those problems. I commend it to the House.
I call Bridget Phillipson to move Amendment C formally. The question is that Amendment C be made. As many as are of that opinion say aye. Aye. Of the contrary, no. Aye. Division, clear the lobby. The question is that Amendment C be made. As many as are of that opinion say aye. Of the contrary, no. No. Tell us for the ayes, Jessica Morden and Colleen Fletcher. Tell us for the noes, Maggie Throop and David Rutten. Pause. Order. Order.
The ayes to the right, 243. The noes to the left, 335.
The ayes to the right, 243. The noes to the left, 335. So the noes have it, the noes have it. Unlock.
Unlock!
The question is the Ways and Means motion. As many as are of that opinion say aye.
Aye!
Of the contrary, no. Order. 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 The question is the Ways and Means motion. As many as are of that opinion say aye.
Aye.
The contrary, no. Tellers for the ayes, Maggie Throop and David Rutley. Tellers for the noes, Jessica Morden and Colleen Fletcher. Lock the doors.
Lock the doors.
Order. Order.
The ayes to the right, 319.
The noes to the left, 248.
Thank you. The ayes to the right, 319. The noes to the left, 248. So the ayes have it, the ayes have it. Unlock. Bill ordered to be brought in upon the Ways and Means resolution. Who will prepare and bring in the bill?
The Chairman of Ways and Means, the Prime Minister, the Chancellor of the Exchequer, Secretary Sajid Javid, Steve Barclay, John Glenn, Kemi Badenoch, and myself, Madam Deputy Speaker.
Okay. I asked you 2 minutes ago. Health and Social Care Levy Bill. Second reading, what day?
Tomorrow.
Tomorrow. Thank you. We now come to motion number 4 on pensions. Minister to move.
I beg to move.
The question is as on the order paper. As many as are of that opinion say aye.
Aye.
The contrary, no. I think the ayes have it, the ayes have it.
I beg to move that this House do now adjourn.
The question is that this House do now adjourn. Daniel Zeitner.
Thank you, Madam Deputy Speaker, and it is a pleasure to have the opportunity to bring to the House a subject which affects every one of us. On the back of a particularly scorching few days and a summer where we've seen unprecedented weather events in mainland Europe as well as across the wider world, I don't think anyone is any more in any doubt that we have a problem. And most acknowledge that our actions as human beings on this planet have played a significant part, and that we have a very direct interest in addressing those behaviours if we are to survive in future. With the United Nations summits on both the climate and nature emergencies in the next few months, it's particularly timely to be looking at what we can all do in our own areas. And my purpose in bringing this debate tonight is to highlight what I consider to be the excellent work being done in Cambridgeshire and Peterborough, and press the government to listen both to the recommendations but also the requests that flow from them. I'm sure the Minister is in listening mode. This is no partisan intervention. We all need to be working together on these issues. It's what the public wants and expects. And while of course there are differences in view, legitimate differences in how some of these goals will be achieved, it is striking to me that almost all political persuasions are contributing, certainly locally. From the school climate protests initially on Fridays a couple of years ago, which were fantastically well supported in Cambridge and quite inspiring, through the explosion of interest triggered by the Extinction Rebellion-led protests, awareness has risen substantially, and the political parties have responded, and rightly so. Now, the first directly elected mayor of Cambridgeshire and Peterborough, James Palmer, was an often controversial figure, and I don't think he would mind me saying that he wasn't too unhappy about having that reputation. Now, between us we had predictable areas of disagreement, but on establishing the independent Cambridgeshire and Peterborough Climate Commission, I think he made an important and bold move. And persuading Baroness Brown, renowned for her national work with the Climate Change Committee, to chair it, gave added gravitas to a highly impressive panel who were charged with the work. And their first report earlier this year came shortly before Mayor Palmer was replaced by my friend Dr. Nick Johnson, the new mayor of Cambridgeshire and Peterborough. And I'm delighted that Dr. Nick has picked up the recommendations with enthusiasm. Now, Madam Deputy Speaker, we're fortunate in Cambridge and Cambridgeshire to live in a truly beautiful region of the UK, with fenland, nature reserves, peatland restoration projects and more. But as the impacts of climate change become more apparent, it's clear we must act to protect those things that make Cambridgeshire and Peterborough so special. Our environmental assets not only enrich the lives of us and we hope future generations, but also provide habitats for wildlife, clean air, and the basis of our local food supply. The work that the combined authority and local councils, as well as many companies and voluntary organisations, are doing to protect all of this is crucial. So, led skillfully by Baroness Brown, the Cambridgeshire and Peter Independent Commission on Climate published an initial report in March 2021 with a series of 31 recommendations for local and central government. The recommendations were grouped into 4 key themes, covering transport, buildings, energy and peat. The Commission will publish a second report, which I'm told is due next month, covering other important themes such as waste, water, business and industry, the requirements for adjustment